like to welcome keynote speech from Dame Nicole Jacobs, Domestic Abuse Commissioner for England and Wales. Nicole was appointed in 2019 as the first Domestic Abuse Commissioner, bringing with her almost 30 years' experience in the sector. First coming to the UK in 1999 as an IDFA, she later became CEO of Standing Against Domestic Abuse. As a Domestic Abuse Commissioner, she now works to improve responses across public services, ensure survivors' voices shape national policy. With over 2.6 million people affected annually across the UK by the abuse of older people, victims aged 16 over are among the least likely to access specialist support. 17% of the UK public who don't see domestic abuse or domestic violence directed against an older person as abuse. We very much look forward to your insights on how we challenge professionals and policymakers to ensure no older person remains invisible in the fight against domestic abuse.
Great, thank you. Thank you, Joseph. I hope everyone can hear me okay. I think so. And I wanted to say to the organizers, particularly to Hourglass, to Richard and the team, but also the chair of Hourglass, Andrea, just a huge thank you for bringing us all together. This has been a really incredible day, I know, and I missed a bit of this morning, was able to join in for the last couple of sessions, and I hope that my discussion and talk with you today will give a little bit more context specifically in relation to domestic abuse in England and Wales. But it's a real tribute to Hourglass to be able to bring all of these incredible kind of expertise together to explain the perspective of Hourglass, which I think is particularly important in thinking about the UK context as a whole, and also just the wide-ranging number of partners and people who need to be involved. And I really love the idea of the conference bringing together so many people, including survivors themselves, to reflect and also debate what is it we need to do to create the safer aging era, and certainly aging society by 2050, which I think is an incredible aspiration and one that I hope you understand how much I support. I wanted to also just give a little bit of context in terms of the discussion, because I know the previous speaker was a minister from Scotland. I wanted to just be really clear in terms of what my remit is and the kind of perspective and input I'd like to have, and how I think that works together to achieve that aim. For those of you who I've not been able to meet before, my role is a public appointee, so I am not a government minister. I'm really pleased you've heard from government ministers across the UK, and I know that you heard from Alex Davies-Jones earlier, and also Jess Phillips. Both ministers I work with quite regularly, but I'm not a government minister, so I don't change with the government. I don't change when ministers change. My role is a public appointee for a term, and I just agreed to a third term for the next 3 years. And my remit is England and Wales. So England, the whole of the kind of approach to domestic abuse in England. In Wales, it is very focused on the non-devolved issues, which is primarily the justice system, essentially family court, criminal court. That does blur a little bit in any context with domestic abuse, because of course victims and survivors, their needs and risks don't sit in particular categories or areas of services or government. It's across, as you've heard today, the whole range: housing, health, court response, the whole of our community response. But essentially my remit as a commissioner is that as England and Wales. I'm very, very interested, and this is why I'm so interested in the previous speakers, of the excellent work going on in Scotland, in Northern Ireland. I think we need to have a lot more of bringing together of approaches. And again, huge thanks to Hourglass for the kind of work that you do, partly because of your perspective in seeing this work across 4 countries, the 4 countries of the UK, that you can help us with that. And that's the leadership that you often are bringing. And I know it's also a source of great frustration to some degree, because I talk about this a lot, the postcode lottery. We use these phrases, but it is absolutely true that we have quite a variance of approaches, and we need to do much, much more in bringing those approaches into a more coherent strategy and narrative, and very specifically, like, set of actions that we undertake to help older victims and survivors. My role in government is to influence, to advise on a day-to-day basis. I meet across all departments for the Westminster government, but I also am independent. So I can, and the legislation that created my role is the Domestic Abuse Act. And it gave my office a couple of powers. One is an ability to seek information from public bodies. And that is not for individuals. I can't, in fact, I'm prohibited from advocating for an individual survivor. I do hear from individual survivors literally every day, and the team here at my office responds individually, but we cannot kind of advocate for individuals and use the powers of the office for that. We have to seek information in order to drive more overarching change. So we hear from individuals, and I do sit with individuals regularly to understand kind of what the barriers are, what we can do, how that translates into what happens for so many others. And I'm also able to lay reports directly to Parliament. And in those reports, I can make recommendations that have a 56-day timeline. So I can make recommendations to government, to other public bodies, where I seek the response publicly in 56 days. And that is just a recognition across the board that older survivors of domestic abuse, all the way through the whole range of age ranges for victims and survivors of domestic abuse, we do have we have such a patchwork of provision. That is my mapping report title, which is showing kind of where we have just huge gaps in provision and support. And the Domestic Abuse Act and the authors of that act recognize that, and that's why they created a role with these kinds of powers in order to address that. So it is probably good context to have said that for some of the points that I really wanted to make. I think it's always worth noting, and this is where I find Hourglass a really interesting organization in terms of the breadth of work done by Hourglass, and also the geographical breadth of work. Because if I often do explain this to many audiences, and I am assuming this audience in particular will know this already, but for domestic abuse services, or the response to domestic abuse, we had our first refuges 50 years ago. I have, in the last year or two, particularly gone to some of the kind of celebrations of the first refuges in England and Wales. And they were 50 years ago, started not by the state, not by local government or national government or any kind of strategic initiative. They were started often by groups of people, mostly women, and who were very, very concerned that there was no place to go for people who were, and I think at the time, very focused on kind of physical violence, kind of that over the kind of clarity of physical violence, sexual violence. Now, over 50 years later, we have coercion and controlling behavior. One of the few countries in the world, in fact, that have legally defined coercive and controlling behavior. And I know that's slightly different in Scotland, and Northern Ireland would like to do that. There, again, we go back to this theme of variation, but coercive and controlling behavior is an offense in most areas of the UK. That is unlike many countries. But I suppose I say that just to explain the depth and the range of provision over time. I moved to the UK from the United States, if you can still hear in my accent at all, in the late 1990s. There was refuge provision. There was I was working in West London at the time. There was refuge provision. There was outreach services. There was a domestic violence Violence Forum, but there wasn't a clarity of what the range of specialist services would look like, should look like. None of these services have ever sat in core budgets. So therein lies the explanation as to kind of why we don't have adequate provision or strategic way of funding services. I would say, I would speak most authoritatively about England and Wales, but I suspect colleagues from other parts of the UK would say the same. And so we have to keep that in mind as we think about what changes we need and want. Partly because that is the reality of where we are. Some of the most unique parts of Hourglass, for example, or other services that provide support for victims of domestic abuse, is the independence of these services. So on one hand, we wouldn't want these kind of ways of supporting victims and survivors to become a statutory function. It's in the independence that I think so much of that bridging of trust and the relationship with victims and survivors is made. But we also must recognize how important these services are and critical they are to victims and survivors, not only victims and survivors, but the whole range of other services that are in a position to help victims and survivors of domestic abuse, but need the support of specialists like you find in Hourglass. So we have to find a way, as we debate these things, which I'm really pleased again to hear this kind of way that Hourglass has set out our day, is just this openness to understanding we are absolutely not where we need to be. We absolutely must see urgent change. And we've got to debate and be clear what it would take to get there. And one thing I'm very clear about is the specialist provision of support must have a strategic funding that is planned and understood in government, and also can maintain its independence and that kind of standing alongside and that advocacy that is needed. That is where we move forward. And I think that's what we've learned many things over the last 50 years. And those are kind of key fundamentals in terms of what we know from victims and survivors they want and need, and really will be able to thrive if they have more of. For those of you who haven't looked up the reports my office has done before, by the way, we're a relatively small office. I don't run a huge department. I run a team of about 20 people who work incredibly hard in the range of priorities that victims and survivors of domestic abuse have in England and Wales. We, of course, always want to do more. We always wish we could do more. We do not have the breadth of government, the thousands of civil servants that government would have in departments. So we try to always, in the way that we work in the Commissioner's office, is use our powers to the best effect, be as precise as we can in terms of priorities so that we can drive change forward. We cannot possibly cover every aspect of everything in the way that we would like. But we do and have managed quite a few targeted reports. One in the very first one was a map called the Patchwork of Provision, and it was a mapping of services for survivors in England and Wales. One of the things we were very keen to do is make sure that when we reached out to victims and survivors, that we did hear from older people specifically. A general survey, population survey, as part of that mapping. So we mapped the provision of service there. But of course, what we wanted to be able to do was put that in the context of what victims and survivors themselves had said they wanted and needed. And we did that in a more of a general population survey, representative of all places in England and Wales, adult victims, really. And we worried a bit about the kind of IT people who would find it a little bit harder to reach out and respond to us in the general population survey. So we ran also alongside that a series of groups. And I want to tell you some of the things that older victims said to us and that we included in that report of the Patchwork of Provision. these are things you undoubtedly have heard already today, but it is important for me just to touch upon them so you understand the perspective of us here at the office and my perspective as the domestic abuse commissioner. But what older victims and survivors said to me was that there were age-related, sorry, I had a window pop up, but I think we're okay unless I'm hearing anything, and I should probably keep a look at the chat. I think you can hear me okay. There were age-related factors that increased vulnerability, that made it harder for them to leave their perpetrator of abuse, and they tended to tell us they were more socially isolated, older victims and survivors. Support networks could have been reduced because of parents and other family members, colleagues, people who they would normally reach out to, less able, or maybe had passed away. The physical and mental health problems or challenges that increase with age. These are the things that really were pointed out to me from older victims and survivors. That increasing a perpetrator's likelihood to be able to control or frustrate their attempts for help, and that retirement, reducing the victim's kind of opportunity and to reach out and see other people, to have independent income, social contacts, those types of things. When older survivors talked about leaving, they talked about being unaware of some of the legislative changes that had happened recently. Frankly, I hear this from many victims and survivors. We very much dependent on the knowledge of other frontline services or other people they might be touch points to for initial support and advice. Things like awareness about coercive and controlling behavior, those patterns of abuse that often over our societal norms and our societal thinking about how we define domestic abuse has changed over the years. Of course, the Domestic Abuse Act has given us a statutory definition, one that we should all know and understand and be able to pass along an understanding of. But this is, again, what survivors often were feeding back to me during this bringing together of this report. Reluctant to leave home that maybe they've lived in for quite a long time, sometimes decades. Those who might have had cultural, religious beliefs in terms of marriage and commitments of marriage and thoughts and feelings about separation or divorce. And when seeking help, barriers that were really put in place that felt very particular to older victims and survivors. The Older People's Commissioner in Wales has done quite a considerable good reports on kind of fleshing a lot of these dynamics out. And I do, even though they're done in the context of Wales, of course, some of these dynamics are applicable regardless. I make sure in my ways of kind of communicating to strategic leads on the ground, who I email and communicate with every month, by the way, I've sent all of these reports about older victims and survivors to strategic leads across England as well, because I think the quality of this work is so important. The work of Hourglass and others is so important. But less information accessible online was a particular point, consideration or barrier that was pointed out to me from victims, older victims and survivors. Difficulty if there is any kind of hearing loss or age-related disability that just makes it much harder to communicate and seek help. And also isolation from intersectional factors such as race, gender, sexual orientation, poverty, health. There are so many things that I know you've talked about today. So in that patchwork of provision, I did make recommendations that were specific to the needs of older victims and survivors. When I make recommendations, I absolutely am fully behind them. We keep after them. In fact, we've spent the summer for this new government, or maybe relatively new government, I know, in Westminster government, consolidating our recommendations that we've made in all of our reports, some of which have been successful and some of which haven't. And one of the things that I believe hasn't been as successful, and I will come back to this in a few minutes, is the way we plan for funding for older victims, for across the board for so many victims and survivors who I believe get lost out in local commissioning provision. And I promise I will touch back on that. But there were a couple of things I wanted to just highlight to you as interested and passionate advocates in this area of a couple of bits of information that I think is quite relevant that maybe you don't know about or have possibly seen and forgotten about, but I want to, again, put in front of you to use to your advantage when you're advocating for victims, older victims and survivors. One is that report that I just mentioned, Patchwork of Provision. The other is a report on our website from HALT, which is the domestic abuse homicide reviews from over 300. The Manchester Metropolitan University was able to get a research grant to take and distill findings from these reviews. It is an incredible source of information. It's something that government hadn't done. And thankfully, the academics at MMU were able to get access to these reports and distill kind of analysis and findings from those reports. What they hadn't done was look at the actions from reviews and what in particular categories. So what I asked them and commissioned them to do were 4 particular reports. One was about children's social care, one was about the criminal justice system, one was about health, which I think heavily impacts older victims and survivors of domestic abuse, and one was specifically about adult social care. Because I wanted to, as commissioner, to provide to myself, but to you and to government and anyone else, the absolute distillation of what actions we already understand from the most tragic of circumstances. The actions that have been decided at the local level must be done to address domestic abuse. And I wanted one of those reports to be in adult social care because I understood that so often we are overlooking the needs of older victims and survivors of domestic abuse. We have those actions in those reports now that we can be using. And so please have a look at that report on my website, HALT, H-A-L-T. And just as a quick overview, they focus on 65 domestic homicide reviews for over 65 and touch on many of the points I've already made, frankly. So I won't repeat them. There's a lot of interesting information in these reports. 50% of cases, the perpetrators were acting as the main carer for the victim, often due to illness or around poor mobility or cognitive decline. If there's any more startling wake-up call we need, it is looking at that particular report. There's also research by Hannah Bowes, Dr. Hannah Bowes, who is really thoughtful about giving us information in terms of the gender disparity, particularly, sadly, in homicides, where we can see some differences between older men, older women, and I'm sure you may well have covered that today. Another report, I think, that gets overlooked and that we try to highlight and put out to the world as much as possible is the analysis of safeguarding adult reviews. There was a really excellent report done by the Local Government Association Director of Adult and Social Services, a joint report looking at safeguarding adult reviews between 2019 and March 2023. And it shows that domestic abuse as a factor in safeguarding adult reviews has increased from 10% to 16%. So we need to be looking and making sure we're collectively highlighting this. So what do? We I think we need more convening like we're doing today. I've spoken with Hourglass about particularly, in fact, just before we started, Richard was making the point rightly that we're well past in terms of our understanding of prevalence and numbers, that this is a niche issue. But what is very specialist is the kind of skills and knowledge that those at Hourglass have, those within the domestic abuse kind of specialist services sector have, where you are really addressing within the context of adult social care, within the context of health services, housing, what the needs are for particular older survivors. And we need much more of that convening and bringing together. You can see on my website, there's a really excellent blog from an organization called Chad and Dudley, where they have employed specialist domestic abuse workers for older survivors, for example. So there's these, again, this is the kind of work I often see across England and Wales, pockets of very good practice. We need to find ways that we drive the kind of connection to organizations like Hourglass, the connections from local work and that coordination with Hourglass, which I know that they do particularly well. But we also need to see a greater network of kind of what good looks like, a definition of what good looks like. And I know that is a lot about the work that you're doing in the Safer Aging Index. We need also to have local strategic partnerships for domestic abuse and violence against women and girls, whatever they're named and called, which does differ from place to place, connecting much more strongly with adult safeguarding boards, conferences, learning events, all of that kind of work that we fully expect should be going on at the local level. And we need to see so much more of that. There's a lot of research out there, I know, about the thresholds for interventions and help and support, raising as resources are short. This is where so much of these findings that I've mentioned earlier in reports are pointing us in this clear direction. There is, in 2015, guidance by the LGA and the Association of Directors of Social Services. We need to find the ways at the local level to highlight and concentrate, whether they're task forces, task and finish groups, core threads through local strategic partnerships about this. And then we think about, and I think daily about what we could expect from our government. And please excuse me in Northern Ireland and Scotland and just this occasion, because in this context, I'm talking about what ministers like Alex Davies-Jones, like Jess Phillips, who you've heard from today, can do. Alex Davies-Jones sits at the Ministry of Justice. They have set out guidance for specialist IDVA and ISVA services, independent domestic violence advocates. They will be overseeing in the next year a duty to collaborate for domestic abuse and sexual violence services. That's in the Victim and Prisoners Act that will be instituted in the year 2026. There'll be a guidance that will be out for consultation at the start of the calendar year. Please, let's all, and you can count me in on this. I work on it, and the team here is working on it already and has been for the past year. How do we make sure that that duty to collaborate will include the provision of support for all victims and survivors? That includes children, that includes older victims and survivors. We have to take these opportunities, these levers within government to get that right. We also need to see a strategy that emanates from government that shows a clear intention to make sure there is this thread of understanding about what we do in particular for older victims and survivors of domestic abuse. We haven't seen the strategy published yet. It's soon to be published. I'm sure this is what you heard ministers speak about this morning. Perfect timing for them to be reminded and walk away and ask their civil servants how much language in the strategy is tying to your Safer Aging Index, there should be, that is the kind of thing. There's still a bit of time. I think it is getting short on time, because I do think they want to publish this strategy. But that the strategy is essentially the work plan of government. It is not a report that sits on a shelf. It is the work plan of government. It is what all civil servants across departments will be holding themselves to deliver for their ministers. It is incredibly important that we see the language and reflected about all victims, including quite obviously, older victims and survivors, given the depth of our understanding and all of the research and all of the kind of prevalence that we clearly know. I believe health plays an incredible role. I know from my own mapping, it's one of the first ports of call for any victim and survivor. We have traditionally not seen enough in the prevention space, but also not in these real impactful areas of work that link us most early to victims and survivors, much earlier before they might consider calling the police, for example. The friends, family, social networks, health, the whole range of health opportunities, that must be in the strategy that we see in this government, again, for England and Wales. Housing. We have achieved in Part 4 of the Domestic Abuse Act a duty for housing. And for that is not the community-based work that I think is a huge gap, and the kind of thing that I think needs much more attention and in the VOG strategy in terms of how we strategically fund these services. But housing and accommodation-based services, there has been a statutory duty imposed. That means the Treasury does give money to Tier 1 authorities to implement and plan a strategy. How are we improving provision of accommodation-based services for older victims? One of the things I have done as commissioner is at opportune moments when needs assessments have been done in relation to these duties, I have sent the report from the Older People's Commissioner in Wales to say, look at the needs of older victims, and you've got to plan this in. I think there is much more we can do as we start to see what is the kind of provision that is being achieved through this duty. Is it changing to make sure that older victims are more comfortably accommodated and their needs are understood within accommodation-based services? So I know that is a lot to say. I think there's also, last point, a lot that we need to do. And when we think of these intersecting issues, LGBTQ plus older victims who face additional barriers in relation to their own religious background, cultural background. We know that by and for provision is incredibly important. I've done a lot of work in my office about advocating to government that that type of provision has got to be planned more strategically from the center. This is what gets lost out in local commissioning arrangements. So I feel like I've probably opened up more issues than I've shut down. But I hope that you understand some of the levers that I'm looking at as commissioner in terms of ways that we can make significant steps forward. I think there's probably many other strategies within government where we need to see a stronger tie to the VOG strategy, to the kind of safer aging ambitions that Hourglass and I know we all share. And I hope that I've not talked so long that I've not left any time for any questions. But thank you so much for having me. It's been a real pleasure to be able to share some of my thoughts with you. And if you have thoughts in terms of what I can do as an office, please let me know. Let me know through Hourglass. I would like to hear if I'm not spotting opportunities that you see are really needed and could be addressed. Please let me know. Thank you.
Thank you, Dame Nicole, and for those comments at the end as well. Luckily, you've answered quite a lot of the questions throughout that speech, so I've got a few left. Do you think we should have a domestic abuse commissioner in Scotland? And what are your thoughts on having an older people's commissioner?
I
That's in England and Wales.
yes, I
England, sorry.
think I've often spoken to people in Scotland and in Northern Ireland who've been very interested in what I do, and I really don't want to speak kind of emphatically one way or another. One thing I can tell you about a commissioner's role has nothing to do with me personally. But one thing I have learned in this role is that government, as ministers change, when there's reshuffling, when there's a change in government, what you see is an awful lot of disruption, and issues like ours get kind of picked up and put down, unfortunately. There's like kind of a big push, like say the Domestic Abuse Act is a great example. Then there can be a little bit of, okay, what else are we on to? There's so many competing priorities. And I think what Richard said to me earlier is right. And I often say this to people too. Domestic abuse, and he would probably couch it as, the abuse of older people. Both things are so prevalent and overlapping that this can't be something that gets picked up and put down. If Scotland and Northern Ireland have mechanisms where you can have a non-party political way that you hold that momentum or keep that momentum going, that's what is needed. Whether you do that through a commissioner or a different way, by all means, there's probably other ways. I do feel that an older people's commissioner in England and Wales would be a huge benefit for example, to me, just because I know how much I have depended in the past and really benefited from the work emanating out of the Welsh Older People's Commissioner about domestic abuse. I don't think I do worry about commissioners for too many things because you start to overlap. But I think given the prevalence, I would find that, and I would imagine government could find it very useful, and certainly Hourglass. And I mean, ultimately, the whole point is victims and survivors would find it useful. So those are my 2 cents, if that's helpful.
I think so, yeah. We would obviously agree with the need for an older person's commissioner in England, and indeed a domestic abuse commissioner in Scotland. What is needed to diminish the postcode lottery in the availability of domestic abuse services, especially for older victim survivors?
I mean, in short, what I would say is that government needs to employ a strategic funding model. So what's happening in government right now is when money is short or there's so many competing priorities, no one government department wants to be the one who bids to the Treasury for the breadth of domestic abuse. And if you think about the way departments are set up, they're not really set up for kind of here's the range across government. They think that, at Home Office, Jess Phillips is thinking, what is the policing response? What is what are we responsible for at the Home Office? Alex Davis Jones is thinking, what about the court system? So essentially, what hasn't happened, in my view, is a cross-departmental, where is housing? Where is the Department of Education? Where is the Department of Health and Social Care? All of these government departments have got to understand there must be a combined contribution that will help settle down this strategic funding. And that there's a lot of, you could track all the channels of funding coming from government, but they're not planned in a central way. And that creates a lot of difficulty locally to really patch that together. So I do think there's a much better way. Trusts and foundations also say to me, if they understood better what the government was doing and was going to fund, they could contribute to so much more in a more strategic way too. That must be kind of where we're looking to settle down. We've got to recognize it's been 50 years now. We need to kind of take stock, understand what is needed, and now be very strategic about these really essential life-saving services and make sure that we end this notion of, well, we just have to accept some will be better in some areas and not in others.
Thank you for that. And I'll squeeze in a final question, and probably quite a good one to end on as well, actually. So let's find it. You've done some really good work in your first two terms, particularly recently on children. Will you make the abuse of older people a priority in your third term?
Yes, I mean, I would hope um, I would hope that a lot of the reports that we've done, there would be a recognition that they're not done for a particular group. Children's report was one, partly because we heard from so many areas that even though we had defined children as victims in their own right, many areas didn't understand what that meant. And I've talked about some of the very specific kind of work that we've done in relation to older people. But you're right, there is always so much more work to do. There's a lot that I would say, if we were, for example, as an office, really focusing on the health response, by definition, that is going to impact older victims in a very significant way. So there's a little bit of kind of what you do for all victims kind of rises all boats in terms of the response. And then, yes, absolutely, I would really welcome and do welcome working with Hourglass, others who are really specialists in this area, to do anything I can to make sure that the particular focus that you've talked about today and I've tried to kind of outline are addressed for older survivors in particular.
Right. Thanks so much for that. And I think we'll leave it there. Thank you so much for coming and
Thank
speaking
you.
to us today, and for everything that you do for the sector. And we very much look forward to, here at Hourglass, engaging with you in your third term. Congratulations.
Thank you very much. Thank you for all the reactions. It's very encouraging as a speaker when you see the clapping coming up
Claps.
on your screens. Lovely. Thanks so much for having me.